Well, for most of us, a trip to the dentist isn't exactly something we look forward to, but you know what? I'm an exception to that rule. I love my dentist. I go every 3 months, no joke, because it's that fun. But I know that a lot of you hesitate on going to the dentist. It is something we need to do: routine cleanings, fillings, crowns, other major procedures, and dental bills can add up fast. So, what is a fair price to pay for taking care of your teeth? On this week's edition of How Much Things Should Cost, we're talking about the cost of going to the dentist. Let's now head over to Dr. Doug Hamilton, dentist at Westmount Dental Care. Dr. Hamilton, welcome back to the show.
Hi, how are you?
I'm doing great. No joke. It seems like my longest committed relationship in life is with you. I mean, I've only known Olivia for about 5 years, so this is pretty
Yeah, we've been
incredible.
going steady for a while.
So let's talk about how much a dentist should cost. I know there are a lot of things that go into pricing, and then of course a lot of people have insurance that covers it. So how do we view that, Dr. Hamilton, on just how much you should be paying when you go to the dentist?
Well, I'd probably frame this a little bit differently than, it costs $16 or $18. I think the important thing to realize is that most times you go into the dentist for a cleaning, that procedure may cost you close to the same amount every time you go in to see a particular dentist. But all the other fees, there's going to be so much possible variation because it could be a little filling, a big filling, a crown. So it's really hard to say what anything is going to cost. You just aren't going to know. And I think if people are thinking about shopping, it's very hard to do price comparisons because cost structures for most offices are going to be different depending on rent, cost of personnel, etc. So it's a very, very difficult question to answer.
So
There is a provincial fee guide that gives guidance on what the average fee would be in the province for a particular procedure, but that's usually seen as a baseline. So most people will be charging more than the fee guide or fee guide rate.
So what's interesting there, you mentioned the fee guide, and I'll just bring up I saw you last week, for crying out loud, Dr.
Right.
Hamilton, and
Right.
we had a great time, of course, especially when you turned off the lights and inspected my teeth and made sure everything was okay. But I'm looking at, I look at my bill and I look at fee guides and that kind of stuff. Like pretty much everything at your clinic was covered by my insurance up to the exact same price. There was one thing where they didn't cover $4, so your charge was, let's say, $4 more than what the insurance company's max was. The other thing was $25 over, but I was amazed at just how much was covered in that. So, do most places, respect the guidelines in large part, or get close to it?
Well, like I said, I think there's a tremendous variation, and so here's the deal. It's a business, and we have costs and revenues. And you might have a dentist working somewhere in the country, and he's paying $8 a square foot rent, and a guy in town might be charged $40 to $50 a square foot for rent. You might have a young hygienist right out of school, and she gets paid a more base salary, or an experienced hygienist who gets paid significantly more. What is the quality of the materials that are used? For instance, I can buy composite resin at $30 a tube, but what I buy is the top quality stuff, and that's $130 per tube. So there's a lot of different costs on inputs and the outputs, and it's very difficult to compare the quality of the inputs. The other thing that's variable would be the technologies. So a lot of people are cleaning teeth with that gritty paste. We use the GBT system, which is, I think it's a much better technology for cleaning teeth, but it's also very expensive to put in, and that equipment costs money and has to be paid for. So there's, like I say, a lot of possible variations on the input and output, and we try to keep fees. I think all dentists really work hard to keep the fees at very reasonable rates, but you can't work at a loss. So this is why, in the industry, the insurance and the government, which provides insurance as well, tries to paint a picture of dentistry as a commodity. Every filling is the same, every dental office is the same, every cleaning is the same, and it's simply not the same. So you can have just a polishing done on your teeth, or you can have a polishing and a scaling done, or polishing, scaling, and examination, polishing, scaling, examination, X-ray. You can use the greedy paste, or you can have GBT. There's so many variations, and that's going to affect the pricing of what you have in the bill. So again, very difficult just to say it costs X or it costs Y, and it's a little bit more or a little bit less than the fee guide, because you also have to determine what items are in that cost of a cleaning. What is actually being done? And some offices will do much more, and some offices will do much less.
We're with
How
Dr.
much time went into the cleaning might relate to it as well. Some people do a cleaning in 20 minutes. Some people do a cleaning in an hour.
Yeah.
So again, I think what you need to do is basically find an office that you trust, and look to the quality of the health outcomes that you're getting, and that's how you decide where you want to be.
We're with Dr. Doug Hamilton, dentist at Westmount Dental Care, talking about how much it should cost to go to the dentist. The other factor here, Dr. Hamilton, for most people is their insurance coverage, right? So how much the insurance company covers. I know a lot of people now are using the federal plan that's come out over the last couple of years.
Mm-hmm.
So how is that going, and how do you feel, whether it's the private insurance companies or the government plan, how does it do at covering the cost of going to the dentist?
Well, actually, the government plan, will just speak to that in particular, is paying out to doctors about the average rate for dental procedures across the country. So they're paying a reasonable amount, but it doesn't really cover everything. So there's going to be a copay for just about everything that's done. And again, the copay will depend on the office and their cost structures. My office is more downtownish, Westmount Square. We have higher rents than some places, so we do have to charge a little bit extra on procedures that we do. But it covers a lot. And I'll tell you, I had a guy just in this week. It was actually very exciting. I was sculpting all these teeth, rebuilding teeth that he'd ground down to the gum line. Hadn't been to the dentist for almost 20 years. And we're rebuilding his mouth because now he's on the plan. It's
Wow.
exciting to be able to give him some teeth and really fun to do. But it was unaffordable for him previously. Now this plan is making it affordable for him. So those insurance plans are really great. They help people access care, but they don't pay for everything.
Let me ask you to wrap up here. What should when our listeners, maybe they're trying to find a new dentist, maybe maybe they haven't been for 20 years. What are the questions do you think our listeners should ask when they call up a dental clinic or they go to a dental clinic? What are the questions you should ask before, saying, okay, I'm going to go to this dentist?
Okay. Well, number one, I will tell you that the quality of dentistry that we get in Canada is amongst the best quality dentistry in the world. And I know a lot of dentists. I've been in this business a long time, and they are really, really good people, and they are trying to do very, very good work for you. So most offices that you go to, almost, they're going to give you fantastic work and fantastic procedures, and you will get good results. So that's number one. I think you should be very proud of living in Canada. The care you get is going to be very, very good. I think, though, that we have to recognize something, and this is something that even most doctors don't think about, but really what we treat in dentistry is behavioral disease. Dentistry is really, we get problems when we don't do the right things. We make poor choices in food. We eat too much sugar. We don't brush and floss our teeth and do preventive visits. We don't see the hygienist for preventive procedures, which can keep us out of trouble. And then when we get into trouble, it can get very expensive very quickly. And so if our goal is to be healthy, and to me, and we want to keep our teeth for a lifetime and stay out of the dentist chair as much as possible, that means you want to spend time in the hygienist chair. So make sure that when you're choosing an office, you feel comfortable there, that they're giving you instruction, they're helping you understand the behavioral things that you can do to make yourself more healthy. Make sure that they're instructing you and answering the questions you have, or maybe answering questions that you don't even know to ask. Make sure that you're in control of the information that you need to make sure you engage in the healthy behaviors to keep you out of trouble. So you want a place where you can communicate, where you feel this trust and back and forth, and a place where you can learn how to take care of yourself. Get that. If you're getting into a place that takes that much care with prevention, you're probably in a good office that's going to do also an exceptional job with the actual dental work that you might need done.
I got to say, Dr. Hamlin, I joked off the top about my committed relationship to you, but maybe I should have started off with the relationship I have with Sylvie at your office, which might be even more important, right?
Yes, that's where the money is for you as a patient. It's your prevention that keeps you out of trouble. That's the best value. That's where you really have to feel comfortable.
Dr. Hamilton, I'll let you get back to your patients. Thanks so much this morning.
Thank you.
That's Dr. Doug Hamilton, dentist at Westmount Dental Care.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian owned and operated. Charm has been part of your love stories and bromances for over 50 years. And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.